Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Today, Presidential Task Force on COVID-19 says country not yet ready for full opening, extends lockdown ease by another 2 weeks. NCDC visits Cross River State, assesses its COVID-19 free status. And the World Health Organization to review its response to the coronavirus pandemic. From the first index case of COVID-19 in the country, the number of infected persons continues to rise across 34 states and the Federal Capital Territory, inching towards 6,000 confirmed cases. In trying to curb the spread of the disease, the federal and state governments have adopted different strategies, which include a 5-week total lockdown in Lagos, Ogun, the FCT at the initial stage, a partial ease now entering its second phase, and different levels of curfew across states. The need to ensure that the economy continues while maintaining a strong response to the pandemic brought about more preventive measures like ban on interstate travel, the compulsory use of face masks across the country. However, compliance to these measures have been mixed. This evening on the program, we dig deeper into how Nigeria can successfully contain COVID-19. And from the Nigeria Center for Disease Control, NCDC, the total number of confirmed COVID-19 cases in the country is 5,959, with 1,594 patients discharged and 182 deaths recorded. The country recorded 338 new cases of COVID-19 last night across 17 states and the Federal Capital Territory. A breakdown of the figures by region shows that Lagos in the southwest still has the highest number of cases, followed by Kano in the northwest. Over in the north-central region, the Federal Capital Territory is the third highest in the country with 418. Bauchi and Borno have the highest cases in the northeast with 215 each. Edo leads in the south-south with 95, Enugu and the southeast with 12 cases. And President Muhammadu Buhari has asked governors to work closely with the Presidential Task Force on COVID-19 to engender better harmony in the daunting task of checking the pandemic. The president spoke during a virtual meeting today with some representatives of the Nigeria Governors Forum, including governors of Ekiti, Plateau, Sokoto, Ebonyi, Delta, Borno, and Jigawa states. Members of the Presidential Task Force on COVID-19, the Governor of the Central Bank, Mr. Godwin Emefiele, the Minister of Finance, Budget and National Planning were among those physically present in the council chamber, with signs of the safety protocols being observed. According to the President, the pandemic was beyond technology, power and resources, noting that countries that had all those were recording highest casualties around the world. A major talking point from today's briefing of the Presidential Task Force on COVID-19 is the assessment of the first phase of the ease of lockdown. The chairman of the task force and secretary to the government of the Federation, Mr. Boss Mustafa, announced the extension of the gradual relaxation of lockdown by another 2 weeks. According to him, the country is not ready for full opening of the economy, and he urged Nigerians to be understanding with the directive.
The reality is that, in spite of the modest progress made, Nigeria is not yet ready for full opening of the economy, and tough decisions have to be taken for the good of the greater majority. Any relaxation would only portend grave danger for our populace. Advisedly, the current phase of eased restriction will be maintained for another 2 weeks, during which stricter enforcement and persuasion measures will be pursued. The 2 weeks extension of phase 1 of the eased restriction is also to enable other segments of the economy prepare adequately for compliance with the guidelines preparatory to reopening in the coming weeks. For the Presidential Task Force, we share your pains, but our future is in the hands of every Nigerian, and future decisions would depend greatly on our compliance. The measures, exemptions, advisories, and scopes of entities allowed to reopen under Phase 1 of the eased lockdown shall be maintained across the Federation for another 2 weeks, effective from today, 18th May, until the 1st of June 2020.
For the Director General of the NCDC, Dr. Chikwe Hekwazu, he highlights the importance of collective responsibility in the COVID-19 fight, saying the focus should be on how to build a safe environment before restarting businesses.
I think the hardest questions for all of us would be, how do we make our small and medium-scale enterprises, where we can't regulate every man that sells recharge cards on the roads, every small kiosk, every small barber. How do we make those businesses safe for all of us? And that is where the term taking responsibility goes beyond a catchphrase. It really is about how do we do this collectively. So next time you go out and walk down your street to sit down by the kiosk down the street, engage with the kiosk owner and have a discussion, because not everyone really has come to terms with why a small invisible virus has stopped the entire economy. It's very difficult for people to understand what is going on. This is not like crime or electricity or any of the other things that are more visualizable. For many people, they still doubt what is going on, because it's difficult to explain why microorganisms are causing an entire economy to stop. So we need all of us to re-engage with our populations, our people, our churches, our communities, our mosques, our businesses, our schools, our transporters, whoever we are communicating with. Is how do we plan for the new world for now?
Well, one of the states in Nigeria without a confirmed COVID-19 case is Cross River State. And today, a 7-man team from the NCDC arrived Calabar, the state capital, to assess efforts put in place by the state government towards maintaining its COVID-19-free status. Speaking at the Margaret Ekpo International Airport, the head of the delegation said the team has come to build on the gains and also see if there are lapses in the state where the federal government can assist. The team was received by the Commissioner for Health in the state.
We're here on a scoping mission to Cross River State. We're here to discuss with the governor, the task force, state task force, and the Federal Teaching Hospital, Calabar, on this containment of COVID-19. And that is our mission here. We know the state has been doing a lot, and we need to learn from the state as well. Since we have not been receiving any casualties, it means the state must be doing something right. So anyhow, we are here to also see if there are gaps that the federal government can also come in to fill. If there are needs for government to bring in equipment, PPEs, medication, consumables, even the lab. In NCDC, we have on our team staff from NCDC.
Now, over 2,500 violators of the lockdown order in Niger State have been arrested by police. Out of that number, some have been prosecuted by mobile courts set up in the state. The violation of the order has also prompted the task force of COVID-19 in the state to intensify monitoring of checkpoints to ensure enforcement of that order. Here's our correspondent, Emperor Simon, with more updates from Niger.
Police in Niger State says it's not resting on its oars towards ensuring full adherence to the lockdown order by the Niger State government. Over 2,000 violators of the lockdown order have been arrested, according to the police command here in Niger State.
All in all, across Niger State, we have arrested about 2,532 persons, and about 2,360 persons have been prosecuted at our various mobile courts in Niger State. And some of the punishment that are made available for these violators, we have 6 months imprisonment or fine, 14 days in isolation centers, community services, escorting or returning whoever that we felt should be returned back to where they are coming from.
Meanwhile, the Niger State Task Force on COVID-19 has hit the road to monitor those who are responsible for enforcing the lockdown order as it goes from checkpoint to monitor the situation.
Many of them sometimes don't even know what they're supposed to be. Why are they at the checkpoint? Many of them do not know what are the measures that have been put in place and the restrictions. So from time to time, we educate them so that they will be able to use that, to reinforce, the compliance of the order.
Some individuals have been making concerted efforts towards contributing to the effort by the state government in containing the spread of COVID-19. Some young bike riders in the state under the name MX Riders have been going around to share face masks to security agencies. Currently, Niger State has 22 confirmed cases of COVID-19. The state government believes all hands must be on deck to tackle the menace. From Mina, Emperor Simon.
More ways in tackling the menace. Joining us on the program is Dr. Duke Ige, a consultant public health physician. She joins us via Skype from Lagos. Welcome to the program. So the message from the federal government seems to be as you were, just like the first phase of lockdown ease. Are you happy with it?
Thank you for having me. I think I'm happy that we have not tried to move faster than what we can cope with, and that we're maintaining this right now so that we can get it right. We do not have so many cases that will overwhelm our. So in a way, I am happy.
Well, going by the statistics reeled out by the Secretary to the Government of the Federation, it says the virus to some extent is under control, saying that the doubling time has slowed from 7 days to 11 days. But we had our highest single-day infection of 338 just yesterday. Would you say that things are really under control?
Yes, I do think things are, but there's still a lot to be done. Still so much to be done, both by government and by individuals, us, the community.
All right. Just to quickly ask you, you seem to be having a little problem with the audio there, but perhaps with regards to, can we say when Nigeria will know when it has reached, the peak of infection rates as we're seeing across the globe?
Well, reaching the peak means that we have reached the maximum number of new cases that we could have. And the only way we're going to be able to find that out is when we start to have a reduction in the number of new cases. So for now, we have not reached the peak. We're still having new cases that are coming in, being more, they're increasing. Like you said, the last one, they actually increased. That was the highest increase so far. So until we start to see a decrease, a consistent decrease in the number of new cases, we cannot say that we have reached the peak. And so all hands have to be on deck. Government doing what they should do, what they can do about it, which is expanding isolation centers and management centers, training health workers so that they can manage these centers, expanding our testing, because part of the problem is that we're not testing enough, not enough people that have access to tests. We're expanding our testing, and then of course what the community themselves can do, what we can do, what you can do, what I can do, which is taking personal responsibility, make that we are taking all of those precautions, washing our hands, physically distancing from people that are around us, making sure that we're not touching our face without washing our hands, right? So once we are doing all of these things, and then also we need to engage, like the NCDC, the person from the NCDC was saying about engagement from community members. Apart from engaging community members, all right, and lightning, we also need to take that responsibility as well
All
and make
right.
sure that we're talking to people and give them more information, because when they protect themselves, then the rest of us
Protect
are also
others.
protected.
We appreciate your time, Dr. Duke Ige, consultant, public health physician. Thank you for joining us on the program.
Thank you very much.
Still to come, more on the battle against COVID-19 as states adjust to the new lifestyles. We have that and more when we return. Let's update you on some of the state government's efforts across the country with regards to stopping the spread of COVID-19. We begin in Enugu State, where residents are beginning to adjust to the new lifestyle of face mask wearing and social distancing as stipulated by the NCDC. A trip to the Old Artisan Market, one of the busiest places in the metropolis on a normal day, revealed a strict adherence to the guidelines in the market. Our correspondent reports that the number of people who show up at a time reduced drastically, with a good percentage buyers, sellers wearing their face masks. However, the government notes that those who let it hang on their chin and people who don't seem to be bothered about the spread of the virus should be guided. Over in Sokoto State, the government is seeking a partnership with federal government in a bid to come up with a strategic plan to fight COVID-19 in the state. During the ministerial task force team visit, the Sokoto State Governor Aminu Tambuwal assured that the state will continue to do its best in partnering with relevant stakeholders to defeat COVID-19. Over in Kano, the Public Complaints and Anti-Corruption Commission has dragged the council chairman of Kumbotso local area, Mr. Kabiru Panshikara, before a magistrate court over alleged abuse of COVID-19 palliatives meant for the vulnerable. The chairman of the commission said they are focusing their searchlight on more council chairmen accused of diverting the COVID-19 palliatives provided by federal and state government to ease the suffering of poor Nigerians. And according to the state government, Duke Ige, the Jigawa state capital has recorded the highest number of COVID-19 cases in the state, with about 51% of the total cases. Our correspondent reports that a lockdown order is already facing resistance as many people troop out for their daily activities. We hear social distancing is scarcely being observed, despite the state governments making it mandatory to wear the face mask. And finally, residents of Kaduna State have appealed to the state government to increase the days of relaxing the lockdown against COVID-19 to more than 2 days to enable them attend to their businesses and earn a living. The residents made their appeal in reaction to the apology tendered by the state governor, Nasir El-Rufai, over the inconveniences caused to the people due to the lockdown directives. And now joining us for more with regards to steps to curbing COVID-19 is Dr. Adekemi Kiladejo, a public health physician. Thank you for joining us.
Thank you for having me.
Now, tell us, would you say that Nigerians are properly educated on preventive measures in COVID-19?
Okay, thank you for asking that question. I would say that the federal government is doing a lot of work to pump out information through the traditional media and the social media. And then even the Association of the Public Health Physicians of Nigeria is also doing a lot of work. And many other stakeholders are doing a lot of work. However, I would say there's still a lot that needs to be done. One thing is communicating. Another thing is understanding the strategies of communication and having a behavioral change. I think that there are a lot of models for behavioral change communication. And so I think we need to engage more with specialists of behavioral change communication. This will go a long way to help to communicate appropriately to people in the grassroots and the Nigerian, the common Nigerian you see on the streets, to improve the information, the way we perceive the information, and the way we respond to doing the right thing.
Interesting you mentioned models. The Minister of Information today said the level of awareness, according to the NOI poll, is above 99%. But do you think that there are some people that perhaps doubt that COVID-19 exists?
Oh, it's not that I think. I know that there are a lot of people. About 3 days ago, I saw a barber he was about shaving someone's hair, and the person handed him some hand gloves and face mask. And the next thing he said was, does this thing really exist? Every day we see numbers on the TV increasing and spiking. Oh, I don't think this really exists. And I had to go into a lot of discourse with him. And one of the things I would say is that change is very difficult. Some people accept changes very quickly and they move on. You say put on a face mask, immediately they put on one. Some people will question every change at every point in time. Why do I need to put on a face mask? Even if 99 people are putting on, they still ask, why are those 99 putting on? And then you give them the information. Some people will need further explanation on those information. Now, what I'm going to say now is, I think that we need to do more with communication. We need to do more with community engagement. We need to do more with interaction with the community gatekeepers, our religious rulers, our religious leaders, traditional rulers. We need to relate more with the associations, the groups that we have in the communities, the heads of those groups, the heads of the pepper selling group, the heads of the barbing group, and all of that. I think that we need to communicate in a way that they will understand. And there are people that are well trained for that.
Just to quickly get your thoughts, sorry about that. And that is, looking at the next 2 weeks, do you think that compliance being key, that we would have better results in our attempt to contain the virus?
Compliance being key. If people comply more, yes, we should have better results. But suffice to say that what we're seeing with the figures, yesterday we had about 5,900 plus cases. I believe is still a tip of the iceberg. The more you test, the more you see cases. There are so many asymptomatic people moving around the streets that have not been tested positive, but they are positive and they are active carriers. While we are talking about compliance, I think we need to keep preaching the social distancing. We need to keep preaching personal hygiene, washing our hands as often as possible under running water with soap for about 20 seconds, and if we do not have access to running water at that moment, we use as alcohol-based sanitizers. And we also need to put on our face masks. This is real. You need to protect yourself, protect your families, protect your community, and protect the world at large.
We appreciate your time. Thank you so much, Dr. Adekemi Keladejo, public health physician. Thank you for joining us.
Yeah, nice to be here. Thank you.
And while many countries around the world are still easing lockdown measures to get the economy back up, at the World Health Organization headquarters in Switzerland, Director General Dr. Tedros Ghebreyesus has been defending the body, sounding the alarm early to warn the world about the coronavirus. According to him, he argued that it gave countries ample warning, guidance and advice.
It's the first of its kind, a virtual meeting of global health leaders at the 73rd Annual World Health Assembly. The assembly is to discuss a resolution being presented by the European Union that calls for an independent evaluation of the WHO's performance under its Director General, Tedros Ghebreyesus. For UN Secretary General Antonio Guterres, the WHO is irreplaceable and says it needs greater resources to provide support for developing countries. On his part, China's president calls for an independent review of the global response to the coronavirus pandemic under the World Health Organization once the virus is under control. President Xi also defends Beijing's own handling of the pandemic, pledging $2 billion over 2 years to help with the COVID-19 response. Away from the General Health Assembly, Australians in the country's most populated state have begun their first full week of loosened coronavirus lockdown measures, with officials urging commuters returning to offices to avoid catching peak hour trains and buses. Italians are delighted to have their morning breakfast on the tabletop of their favorite local bar, after the government eased lockdown restrictions. After a 10-week lockdown, Italian shops, hairdressers, and restaurants finally are back as the country speeds up efforts to bounce back from the coronavirus crisis. Romans finally re-enjoyed the simple pleasure of drinking a morning cappuccino or cafe espresso or eating a fresh croissant at the bar, albeit well spaced from other clients and workers returning to work.
According to the NCDC, Nigeria now has 26 labs to the National COVID-19 Laboratory Network. You can find the latest guidelines on indeed how the center continues to work closely with states, the latest national strategy on their website. Also, the World Health Organization is saying not everything you hear about COVID-19 is true. It has several campaigns about countering misinformation on the virus in several countries. The website guides the public health response at both national and subnational levels. Also, our website, channelstv.com, has all the stories. You can find the latest update on the pandemic in Nigeria and across the world. That's channelstv.com. Well, that's it on the update. Another one comes your way again at 9 p.m. I'm Millicent Nwaka. Stay safe, stay healthy.